Good evening. Today we are going to discuss about inflammation as a body response to tissues injuries or tissues invasion as a progress of introduction of pathology. So we will start by saying what is inflammation. So inflammation is a local response of mammals tissues secondary to any agent, injuries to any agent. It can either bacteria, a virus, either a physical injuries or even the body itself. So how the body responds to that one is what is an example of inflammation. So defense mechanism of the body tries to eliminate or to limit the injuries, to contain the injuries of the cause of injuries to this tissue, and this is what is called an inflammation. So what causes inflammation? The causes of inflammation can be either infective agent like bacteria, virus, toxins, which can be either endotoxins or exotoxins, can be either fungal, can be either parasite, can be either protozoas, can be either rickettsia. So any infective agent which invades the body, anything which has life and invade our body causes harm in our body, it is what is called infective agent. Another one is immunological agent like cell-mediated problems and also antibody-antigen reactions. Antibody reactions, for example, like asthmatic or allergic reactions, toxins, or things like a bee sting is an example of what? Of immunological agent. Another one is physical agent like frost, heat, cold, radiation, and mechanical trauma, like cuts are examples of physical agents. Then we have also chemical agents. An example, it can be either organic or inorganic poisons, and also we have inert materials just as foreign bodies causing inflammation. So basically, those are the causes of inflammation, and we are going to look at them. So what is the difference between inflammations and infection? What is the distinct difference between inflammation and infection? Infection causes inflammation. In simple way, infections causes inflammation. In definition is that inflammation is the human or mammalian tissues respond to injuries, whereas infection is the invasion of the body by a microorganism which has life and causes inflammation. Inflammation is a protective response of the body so that there is no continuous cause of the problem. It does not go beyond where it is, and it varies depending on the causative organs as we have seen them there. For example, infections, because of infections, the body is invaded by harmful microorganisms which can result to toxins, which can be either endotoxins or exotoxins. So basically, the process can overlap in terms of inflammation process. When the body is doing the response to tissues injuries, at the same time, a healing process is taking place. That is in somebody who is okay with intact immune system. But people with the immune system which is not, which is challenged, like HIV, hence people with diabetes, people with taking steroids, all those people with a problem with immunity, this one does not go like that. So sometimes it causes considerable harms to the body as well. So if inflammation process in the body is not well controlled, just the body goes to its homeostasis situations after the inflammation process, then it can result to harmful processes in the body. An example, it can cause anaphylactic shock, for example, bite by insect, reptiles, and drug toxins, and also atherosclerosis if there is a problem of hardening of the blood vessels secondary to a deposit of the lipid tissues like atheroma. Also, that is what excessive can cause a thickening of the rumen of the walls of the rumen of the blood vessel, resulting to what? To impaired blood flow through that rumen, because the rumen will be small because of atherosclerosis. So it is an harmful method is an harmful cause of inflammation. Another one is like chronic rheumatoid arthritis, because there is excessive response to the connective tissues around the joints, resulting to destruction of the what? Of the tissues and the ligaments around that area, so that there is a rheumatoid arthritis. Then there is fibrous brands, for example, keloids. Another one is adhesions and in the intestines or even fallopian tubes can cause adhesions. Can cause adhesions. So what are the cardinal signs of inflammation? We have the 4 cardinal signs of inflammation, but also we have the 5th one. Number 1, we have redness. Wherever there is an inflammation, there is always redness, there is swelling, there is heat, and there is pain. And also the structure of the body or the organ of the body which is affected by the inflammation can result to poor or loss of its functions. If it is the liver which is having inflammation, either because of liver cirrhosis or because of hepatitis, can result to what? Can result to it not functioning well. If it is the lung which is sick, it is not going to have a proper gaseous exchange there. So those are the cardinal signs of inflammation. All of them, there is a local fever, there is redness, all of them works together. There is a swelling, there is a burning pain, and also there is loss of functions in terms of the cardinal signs of inflammation. So there are various 3 types of inflammation. There are 3 types of inflammation. There is acute inflammation, which takes a short duration of time. Always we say approximately 2 weeks, like that. Then it represents the hard body reaction followed by healing immediately. And then we have the chronic inflammation, which takes a long duration of time, and the causative agent of acute, because of acute inflammation can persist longer and become a chronic inflammation. And also there is another variant type of chronic inflammation where it is a chronic active inflammation. That means from the start to go, it is start with chronicity. For example, a syphilis, the diseases like HIV, hence, and they fall under these cases of what? Chronic active inflammation. They initiate the chronic inflammation process from the word go. So what are the components of acute and chronic inflammation? The component of acute and chronic inflammations are various types of enzymes and various types of cells. For example, you can look there, that is a capillary, which inside it has the cells we call what? Polymononucleoleucocytes. You have lymphocyte, you have platelet cells, you have monocyte, you have clotting factors like kininogen and complement system, which contains the classical pathway, the alternative pathway, and the receptor pathways. And also you have the eosinophils and the basophils. So these are the cells in the blood vessel flowing in between, and they don't touch the endothelium, because when they touch endothelium, they provoke the process of what? The process of intrinsic pathway of inflammation. They provoke the process of pathways of intrinsic inflammation, and also coagulation, the intrinsic pathway of coagulation, which is a problem in our body. So they flow something called a turbulent blood flow. On the sides, it is the serum, but in between is the blood, so that they don't touch the walls unless if there is an inflammation process. So these are the cells which respond to inflammation. They are the cells that respond to inflammation. But later on, we will see how they migrate from the capillaries, inside the capillaries, up there to the places where they are supposed to respond to inflammation. All that process, we are going to see it later somewhere. So at the connective tissues, you can see there is the mast cells. The mast cells, they produce heparin. They work together with the basophils, and they produce what? They produce heparin, they produce histamine, and also they produce prostaglandins. In terms of factors of acute inflammation. So they are in the connective tissues, and that is their work. And then we have fibroblasts. These are the cells for fibrosis, and we have macrophages, the cells of chronic inflammation, and their main function is to engulf a micro pathogen. The other ones is the connective tissues. You have the elastic fibers, the collagen fibers, and the proteolycans. These are the tissues which are holding these capillary in place so that it remains in place. There are millions and one capillaries in our body, and they are surrounded by that. So basically, that is the physiology, and this is the anatomy of a capillary surrounded by various structures on the side and inside it. So those are the components of acute and chronic inflammation. So I think we have to end this lecture there. Then next time we'll talk something else. For today, that is enough. Thank you very much for listening to this.